Hello, everyone. My name is Dr. Marianne Gausche-Hill. I'm the medical director of the Los Angeles County Emergency Medical Services Agency, professor of clinical emergency medicine and pediatrics at the David Geffen School of Medicine. I'm also clinical faculty at Harbor-UCLA Medical Center in the departments of emergency medicine and pediatrics, and senior consultant for the EMS for Children Innovation and Improvement Center. And today I'm here to talk to you about a topic that we've all had to face with the increase in behavioral health conditions that we're seeing, especially in children. So the title of my talk is Safe Control of the Agitated Pediatric Patient. In regards to disclosures, as I said, I'm a senior consultant for the EMS for Children Innovation and Improvement Center. And this is funded through HRSA HHS, and you see the award there. And I need to state that the contents are those of myself and do not necessarily represent the official view of nor endorsement of any of the federal agencies, including HRSA, HHS, or the US government. So thanks. Here we go. So we're going to start out with some of the resources that are out there. And this is a great algorithm that can be incredibly helpful, along with additional resources that are at the site. And we'll have a QR code at the end so you can click onto it. But this is by the EIIC and TREC, which is Translating Emergency Knowledge for Kids. As you can see, the algorithm starts out in recognition of agitation, some of the initial strategies like de-escalation and calming, and then it moves to what is your assessment? What do you think is going on? And potential pharmacologic interventions, if indeed those are necessary. Let's move to scene safety and some of the issues surrounding workplace violence. So what is the problem? It's actually quite common. Well, you can see I took an iPhone screenshot of when I was on shift one day, and you can see we have 6 kids between 8 and 15 with either suicidal ideation, suicidal risk, or psychiatric issues. It could be, explosive disorder, etc. It's not uncommon that we have that many patients that we're managing on our shift. The other thing that I really want to highlight is the importance of environmental situational awareness, understanding what security you have. And again, we'll go in the second part of this, we're going to go into how you recognize potential violent patients. So 50% of healthcare workers are victims of violence sometimes during their careers. And I think it could be patients, it could be family members. 78% of emergency medicine residents report a violent workplace act in the last year. So again, we all have to be aware of our surroundings and make sure the environments that we have some of our behavioral health psychiatric patients are safe for them as well as for the workforce. Overall, emergency departments are high-risk environments, and a study that was published demonstrated that only 23% of emergency departments have 24-hour security. I think this is going up every year. There were over 255 reported acts of violence in emergency departments over the last year as well. So it's not uncommon. I wish it was less common. So we just have to build that awareness and set up our environment in such a way to protect ourselves. And again, most don't have dedicated security. So what are the mitigation strategies for violence prevention? Certainly metal detectors, I think we all have stories of bringing in the trauma patient and then discovering he's got a gun or a knife in his pocket or her pocket. So those metal detectors can be really helpful, at least in screening the patients that are ambulatory. 24-hour security presence is helpful. That often mitigates the elation of bulletproof barriers in triage and public-facing areas, I think is really critical, especially in triage. A keypad entry to the ambulance bay. We used to just have open ambulance bays. Anybody could walk through those. And now I think many hospitals have a keypad. And as an example, all the MS ambulances that come to that particular hospital would have their own code and then staff would have a code. Staff monitoring of all points of entry. And the other thing I can say is limit entry points. And many of the hospitals have done that as well, and schools for that matter. So that is a very important mitigation strategy, because you can monitor a smaller number of entry points and you only know there's 2 ways to get into the building, etc. And then barriers so that vehicles cannot drive into the emergency department itself. And those can be concrete block barriers. Something like that, I think, is helpful to keep someone from driving their car right through the ER. So what about setting safety? And I mean the setting that you work in. And you can see up in the upper right that this is clearly not a safe looking area, right? This is not a patient care area, but just to point out that even small items can be missiles. And the other thing that you would not want to do is go in and see a patient with behavioral health problems with your stethoscope, or you use your stethoscope and then you put it down, I think is the best way to handle it. So what about the setting safety? All patients should be screened or searched, all right? Routine practice of placing patients in gowns for the reason I outlined, that trauma patients may come in with weapons. And this is something I learned in medical school, and I always think about this today. You always want to place yourself closest to the exit when you're evaluating patients. Again, I mentioned the room with no objects. I think this is critical, but any of these objects can be used as weapons. So scissors, pens, belts, no cords in the room. And in the lower right, you can see there's any of a number of cords in this space. Obviously, this is more of a resuscitation space, but this should not be a room that is used, or a room like it, for behavioral health emergencies. Here's a QR code that's going to link you to the resources that you need, that EIIC algorithm, which I think is really helpful, and the medication table. I personally want to acknowledge Doctors Patrick Kelly and Eric Chung for their assistance with me as I developed this talk for you. And obviously the wonderful expertise of the EMS for Children Innovation Improvement Center and TRAC, for them really coming together to collaborate on these resources that will help you take better care of your patients. Thanks for listening. You can email me at mgausche-hill@dhs.lacounty.gov, or on Twitter at mgausche-hill. Thanks so much.